Pain is considered as the fifth vital sign, and it is included in most of the patient charts in the hospital. But it's something which never gets assessed. All right. The reason is because it's subjective. You can't actually measure pain. There is no visible thing that you can measure it against. All the four things: pulse, blood pressure, respiratory rate, temperature, can be measured, and you have a value for it. Whereas pain, it's not objective. Okay, it is subjective. So this pain scale, the number 0 to 10, and the phases are there in our nurses' record, but it never gets recorded. I don't think even doctors bother to ask patients about their pain, even though it is one of the commonest symptoms that the patient comes to the hospital with. Okay. So a pain scale, just by showing the patient a pain scale, you're actually telling the patient that I'm interested in knowing you more. I'm interested in knowing your pain better so that I can treat you better. Right? So most of our patients understand numbers. 0 to 10 is not a difficult scale to administer. But sometimes when patients come from villages, it's better to sort of ask them on a rupee scale. Say, do you have 50 paise of pain or 80 paise of pain, that kind of a thing. But if you talk about the pain scale, it starts from 0 and it ends with 10. So people think that, no, 10 is like too small a number, and my pain is 100, So that sort of a thing. So we explain to the patients that 0 is absolutely no pain at all, and 10 is a maximum pain that you can ever have. They're not very, very happy with it sometimes. But most of the patient comply, and we explain to them that this is for your treatment process. And they come up with a number, what they feel is right for their pain. And each patient, it differs. Okay. For example, somebody's pain, if they give a score of 3, another patient with the same amount of pain might give a score of 6, and your treatment varies because of that, and what the patient can bear and things like that. So if you say 0, then they don't need to actually come to us for pain treatment. But 0 is also a very important number, because when you actually treat a patient with pain, and you are assessing the pain relief, sometimes the patients are a little reluctant to say that they have 0 pain. They feel that no, some more pain should come down, and most of the time it might be true. So what I'm saying is, there's a small percentage of people who they have complete pain relief, but they still wouldn't want to say that they don't have pain, because they feel that probably the attention from the doctors and nurses might go away, or that sort of a thing. Again, that also applies to 1 and to the number 1 and 2. So if they say their pain has come down to 1, 2, and 3, then we feel that we are on the right track and our medications are adequate for this particular patient. And we assess every day. We go and see our patients, even if they are referred to us. Every day we assess pain. And if it's in that point 1, 2, or 3, then we continue with the same medications. And it's considered as mild pain. Okay, so when it comes to the moderate pain from 4 to 6, the numbers 4 to 6, that's when you need to really assess their pain and see whether they need a titration upwards with the same medication, or is there another component to this particular pain that we need to look at and address it with other medications. So that's what we need to focus on. So a proper history at this point in time is very important to see whether we are addressing his various components of pain. And this is about the physical aspect. We should also be focused on what is going through the patient's mind. How does he relate pain to his disease process? Because most of the time, patients think that as pain increases, I'm getting towards my end of life stage. That's what people think in their minds. But they fail to understand that, they can live with this disease for many years. For example, multiple myeloma patients. Their pain is very severe, but they have a good prognosis. They live for long. So it's very important to take good care of those patients to give them that quality of life. So the fact that the pain increases doesn't mean that the disease is increasing. It could be increasing, but it's not always true. And there are other things that can be done to lessen this pain by looking at their psychological aspects, their social aspects, and probably their spiritual aspects if you can. All this taken into consideration, we give it a term called total pain. Okay, and this total pain needs to be addressed from different angles, and only then we have a comprehensive care for these patients. So this is a very important tool which would help us to sort of guide us to assess pain, one, and also to assess ourselves whether we are going in the right direction. It helps us to treat the patients with the correct amount of medications, a kind of medications also. And also the patients feel good because we take that much more time to sit down and talk to them and explain to them what this is all about, and we spend more time with them. So they also feel good about it.
Okay.